Signs of increasing healthcare chaos in China as it battles a COVID surge while racing to vaccinate its most vulnerable people. Some patients were seen receiving care on the streets outside a clinic in Xiaogan, a city in China's Hubei province. Others were tended to in their cars while parked outside a hospital. In the capital, Beijing, residents are still swarming those pharmacies to stock up on medicine. There have been reports that people in Hong Kong, Macau and even some neighbourhoods in Australia are searching for fever medicines and test kits for their family and friends on the mainland. The World Health Organization has raised concerns that the country's 1.4 billion population was not adequately vaccinated. But the WHO has also said that the rise in cases isn't due to the lifting of restrictions. WHO Emergencies Director Michael Ryan says infections were spreading intensely long before that.
There's a little narrative at the moment that in some way China lifted the restrictions and all of a sudden the disease is out of control. The disease was spreading intensively because I believe the control measures in themselves were not stopping the disease. And I believe that the Chinese authorities have decided strategically that for them is not the best option anymore.
For more on this, let's speak to Lo Minmin. Minmin, the WHO is saying China's COVID spread isn't due to its lifting of restrictions, but down to those earlier control measures that weren't effective in stopping the disease, that it started long before. What is China saying about its ability now to get through this peak of the pandemic?
Well, China has not given an official response to that WHO comment. But yes, if you look at those numbers, infection rates have been on the uptrend prior to the lifting of restrictions, especially in Beijing, where infection rates tripled in the 2 weeks ahead of the lifting of restrictions, which is prompting some to argue that China had already lost control of COVID-19 before deciding to give up on the zero COVID policy altogether. But still, it is really difficult to ascertain what exactly led to this peculiar timing of reopening unless we have a way to peer into the minds of Chinese leaders, because many only expected China to open up in the spring, certainly not in winter when the virus is known to spread more quickly. But we do know that China has been spending more money for diminishing returns as the Omicron variant spreads quickly to every province. Provincial governments are spending at least 1% of their GDP on COVID-related expenses. What's puzzling, though, is why China did not prepare for this moment earlier by ramping up its healthcare capacity and pushing for a vaccine mandate. And experts are saying that those protests against zero COVID had accelerated the pace of reopening earlier than expected. It provided a political off-ramp for the government to switch gears and also a way to shift blame to the people should the reopening go wrong.
Minmin, there's been a cost to the economy as well, and President Xi Jinping and senior government officials, they've begun this two-day meeting to plot a recovery path, perhaps, for China's battered economy. What's the latest we have on the impact to the economy since those curbs were rolled back?
Well, you know, so many people have been calling for the end of zero COVID in China. But now that China has actually done it, experts are saying that the positive effect is going to be offset by the surge in COVID cases in the near term. So industrial production likely to remain weak in the next couple of months, especially if factories become deserted from rising COVID cases. Already we are seeing official government work being disrupted, with a key economic meeting being postponed, and retail sales also hard hit. If you walk around the central shopping district in Beijing, it is practically a ghost town. And remember, this is just the beginning of a massive wave about to hit China. Since the lifting of restrictions, we are seeing bookings for travel-related services during the Chinese New Year period go up 12 times. This is back to pre-COVID levels, but it also means we're about to see a massive migration that could become a super spreader event that could really severely disrupt the economy.
Minmin, thank you for that. Lo Minmin there with that report.